Good afternoon, everybody. Good afternoon, everybody, and thank you for joining us. Our topic of discussion today is on healthy aging. It's something that we really have very little control over, um, and it's a process that we can't stop. So let's talk about healthy aging. The goal of healthy aging is living longer, happier, and healthier lives. So let's see. Heather, now it's not wanting to change. Let me see. There we go. So let's talk about aging in itself. What is it? Of course, it's a natural process that occurs as people get older. Um, it's believed that aging is caused by a buildup of damaged cells and molecules that occur over time. And this leads to a gradual loss of physical and mental capacity. It's the time-related deterioration of the physiological functions that we need in order to survive and to reproduce. So I guess one of the things I found very amusing when I was doing this presentation was the idea that, one, not only are we deteriorating, the fact that we are no longer able to reproduce categorizes us as being old. But anyway, people age differently. And it's important that we understand that we all age differently. And not only is it important that we understand that whoops, now it's doing what it wants to do here. Not only is it important that we understand that we age differently, we also encounter different health conditions and obstacles as that aging process occurs. People generally fall into one of four categories of deterioration, if you will, as we age. One of those is a decline in our immune system, decline in our kidney function, decline in our liver function, or an overall metabolic decline. And unfortunately, this can occur in multiple phases for many people. So we generally fall into one or more of these pathways as we age. And so when we look at immune agers, um, they may generate more inflammatory processes and therefore be at higher risk for immune-related diseases, such as arthritis, such as things like Raynaud's syndrome, other immune-mediated disorders that can occur. Immune-mediated disorders, like I did say, arthritis being one of them, usually occur as we get older. Now, metabolic agers are at higher risk for things like diabetes as they grow older. There is a decline in the metabolic processes. For diabetes, one of those is the production of insulin. As we get older, there is a natural decline in our hormone production, and insulin is a hormone, which can lead to being a risk factor for developing type 2 diabetes. Statistically, 65 years of age and older is the range that we are seeing type 2 diabetes occurring in the higher levels of the population. What I mean by that is 29% of the individuals 65 years of age or older in the United States today have been diagnosed as either being pre-diabetic or having type 2 diabetes. Those individuals that have liver and kidney ages, they become more prone to liver and kidney disease, respectively. There's hepatitis, there's kidney failure, there's things like renal cell carcinoma. A number of these levels of deterioration specifically target those two organs, the liver and the kidneys. And of course, there are some people that age in multiple pathways. You know, as they become older, their immune system becomes deteriorated and they end up with rheumatoid arthritis. Their blood sugar levels start to go up and they're diagnosed with diabetes. They have issues with fatty liver or renal function. And so the body itself starts to systematically break down. It's important that we understand how our lifestyle factors may or may not interact with our biologic patterns. And in doing so, this aging causes us to more effectively have these breakdowns. And so it's important that we know where those breakdowns are occurring so that we can tailor our interventions as we cross adulthood. I know that may sound a little confusing, but basically what I'm saying is if we know how the body is deteriorating, that is our ageotype. And if we know what our ageotype is, then we can do things to help slow that process of aging in that particular area. So when we talk about the 5 pillars of healthy aging, most of these a lot of people know about. We know that good nutrition is important for healthy aging, physical activity, social interaction or engagement, mental stimulation, and meaningful activities and relationships all help to promote healthy aging. So when we look at these individually, we're going to go into a little more detail. First would be good nutrition. Well, good diet plays an important role in promoting a person's overall well-being during your senior years, especially. A healthy diet for the aging includes eating enough protein, and that is a requirement of about 15 to 30 grams of protein per meal, with being 3 meals about every 4 to 5 hours apart. It includes such things as eating seafood, dairy, fortified soy products, beans, peas, and lentils. Eating a variety of foods. As we become older, adults should eat a variety of foods from each of the food groups, and it will help to reduce their risk for chronic diseases. Unfortunately, for a lot of people, as they age, their food preferences change. And we have some that don't want to eat vegetables any longer or prefer not to eat meat. And for a number of reasons, it may even be dentation, structure. Uh, People have texture issues, things of that nature. But it is important that we maintain a variety of food so that we are taking in all of the macronutrients that the body needs. As we age, we should eat more whole foods. Whole foods are often found in the produce that we purchase, meats, dairy, and we should spend most of our time and our money in the perimeter of the grocery store. If you think about it, if you walked into an HEB or a grocery store and you go to the front of the store, on one side of the store or the other, you have your fresh fruits and vegetables. And then a little further down, you have your fish, your lean meats, your milk, your cheese, your eggs. And so this is where we should concentrate our focus on our nutrition. The closer we get to the middle of the grocery store, the less healthy the food is for us. as we grow older, we should make sure that we're getting enough hydration, drinking enough water. Older adults should drink enough water to avoid dehydration. Some people lose their sense of thirst as they age, and certain medications can actually either increase the desire for fluids or decrease the desire for fluids. And it's recommended by the American Diabetes Association and the Council of Aging that about 15.5 cups of fluid should be taken in on a daily basis for men and about 11.5 cups for women. So as we grow older, hydration becomes a very important factor in our nutrition. We want to limit added sugars, saturated fats, and sodium. I teach a nutrition class, and one of the things I teach them is a food mantra. What we should consume should be low carb, low fat, high fiber, high protein, and low sodium. So we should be eating fruits, especially fresh fruits and vegetables, because they provide important nutrients, they provide fiber, which helps to block the metabolism of some carbohydrates, and they help to keep the digestive system moving. One of the recommendations is that as we grow older, green tea become part of your dietary inclusion. Green tea is high in antioxidants, which can help to fight free radicals in the body. We want to avoid too much vitamin A because it can increase the risk of bone fractures. So these are things that commonly aren't necessarily known, but if we begin to take on this meal plan as we age, we will find that it helps to serve as a mediator of healthy aging. So when we talk about physical activity is a very important part of healthy aging. According to the current physical guidelines for Americans, adults need about 150 minutes of moderate intensity physical activity every week. This can also be broken down to about 75 minutes of vigorous intensity or an equivalent combination of moderate and vigorous intensity physical activity. This is information that's provided from the CDC as of 2023. The physical activity is a great way to boost your health and your mood. As you age, staying active can also help you to continue to do some of the stuff you like to do. You know, I'll be the first one to admit, I'm 65 years of age and I love to kayak. I play racquetball. I'm a black belt in Taekwondo. Staying active is very, very important, not only to my mind, but to my body. And one of the things that's important and is recommended is to learn ways to make exercise fun so that you stay motivated and that you continue the practice. One of the things we want to make sure that we're doing is making sure we stay fit. And one of the ways we do that is doing conventional exercising, taking part in things in your daily activities, doing things that you find to be fun and that you enjoy, making social connections in doing these exercise. Find a virtual exercise buddy to help keep you going and to provide emotional support. If there's a break in your routine, the most important thing you can do is get back on track. Start slowly and gradually. Build up your intensity of your activity. And it's important too to get other people involved. So asking family and friends for their support will help. And keep track of your progress. Make an exercise plan and don't forget to reward yourself when you reach your goals. When we talk about social engagement, researchers have suggested that people who are socially engaged and involved in activities, they have lower risk for health problems and have better mental and physical health. The amount of social engagement that's right for one person, though, may be too much for another. So it's important to find your balance. Some of the ways to get involved socially as we age is volunteering. Volunteering can help you meet people, use the skills you have developed throughout life. It helps you to give back to your community, and you can volunteer at a local animal shelter, a charity, or even a park. Participate in hobbies. Hobbies can help to improve your health and your quality of life. It can help you to, again, make connections. You can try things that are different, music lessons, book reading, learning a new skill. For me, mine is fishing. And so that helps to keep me young, fighting the fish. Yeah. Participate in online activities. They can help you stay socially engaged with family and friends. Once a week, I have a Zoom Bible study with my grandchildren. You can try online games, virtual classes, online communication tools like FaceTiming and Zoom. Participate in group activities. Join a group activity like walking or hiking, bird watching, or even exercise, and do outdoor activities. You can join a group that to help you stay active while being out in nature. That's very important that we enjoy the things in life around us. And you can do that through social engagement. Mental stimulation, that's another one. Mental stimulation is a crucial part of aging. It helps to maintain cognitive function, memory, overall brain health, and it helps us engage the mind through activities like conversation, learning new skills, and social interaction. Mental stimulation can potentially delay cognitive decline and reduce our risk for dementia. It also enhances the benefit by providing a sense of belonging, combating loneliness, and promoting emotional well-being in older adults. Some of the key points about mental stimulation and aging itself is cognitive preservation. Engaging in mental stimulating activities can help to preserve our cognitive abilities, like our memory, our ability to reason, and to problem solve. These are things that can deteriorate as we grow older. So we want to continually stimulate ourselves to help to maintain that level of awareness. Brain plasticity. Even in later life, the brain can adapt and form new neurons, connections through the mental stimulation, which helps to learn new things, do new things, and help us to maintain our cognitive function. So many of our aging adults fear dementia, fear Alzheimer's, loss of memory, not being able to recognize loved ones, or they feel like they're stuck in the past. And by using mental stimulation, we can reduce that risk of dementia. Studies suggest that actively engaging the mind through various activities can potentially lower your risk of developing dementia or at least slow down its progression. There are now even games that are suggested for seniors to play on their phone that help to stimulate them cognitively, which helps to slow the progression of dementia. Mental stimulating activities. These are some of the things that are recommended. Playing games like chess or bridge, reading books and engaging in discussion about what you've read, learning a new skill like playing an instrument or painting or sculpting or pottery, participating in group classes like artwork, woodwork, writing workshops, and volunteering in the community. These are things that help to keep seniors active, which in turn help to keep us young. So, development of meaningful relationships. That's a tough one because when I was doing my research to do this presentation, the first thing I thought was, are they saying senior dating sites? But no, that's not what we're talking about here. Meaningful relationships play a vital role in healthy aging by providing social and emotional support, which in turn can help people cope with some of the challenges of aging. These relationships can reduce your stress and anxiety. It helps to improve social connections, which help to reduce stress, anxiety, and depression. It can improve your mood, your self-esteem, and your level of happiness. It can definitely improve your cognitive function and your memory. And it can help to lower your blood pressure and the body's overall inflammation. So making these meaningful connections are very important. It can also boost your immunity and your longevity of life, produce a sense of belonging and purpose, promotes healthy behaviors, provides social support in times of need, and reduce the risk of chronic disease. Emotionally gratifying relationships and the social and emotional support they provide help to buffer older adults against the challenges inherited in the aging process together. Um, Such a negative health change causes changes in the cognitive functioning and social losses. What we mean is that without developing these meaningful relationships, people become lonely, depressed. Their thoughts are not looking towards the future, but missing the past. And for a lot of seniors, especially when the people that they have developed these relationships with are no longer here, they no longer see the need to live. And so it is very important that as we go through the aging process, that we develop, maintain, and upkeep these relationships. So healthy aging. One of the things that we have the ability to do in regards to our aging is self-care. And there are many things that we can do to promote healthy aging. Preventative care or self-care is one of those things. And it helps to aid in the process of healthy aging. Things like keeping your regular scheduled appointments with your primary care physician or primary care provider. It is very important that you stay in communication with your doctor, that you are attending your appointments as scheduled, And it's important that you are prepared for those appointments. What I mean is, if you have questions that you feel like you need answered during your appointment, don't wait to the appointment to think about them. As you think about them, write them down in preparation for your appointment. Even if it's things like, can I eat lobster? Or should I take my medicine with grapefruit juice? Or I fell last week. I didn't break a bone, but I'm bruised. These are all things you want to write down, because when you get to the doctor's office, you may not remember them all, and he may have a limited time to spend with you. So you want to make the most of that appointment. You want to make sure that you're taking your medications as instructed and as prescribed, keeping those prescriptions up to date. You want to schedule your annual physicals and your other exams as you've been directed by your physician. It is very important that you keep your vaccinations up to date. As we age, we have alterations in our immune system, and these vaccines, for some of us, can mean the difference between healthy living and dying. You want to maintain proper eye, dental, and foot care. You want to maintain good care for the whole body, but specifically, the eyes should be checked once a year to make sure that you don't have glaucoma, retinal tears, diabetic retinopathy, macular degeneration, and a number of other diseases. And one of the best ways to make sure that we have good eye care is a good consumption of carotene and lysine. These help to, one, help make the skin look moist and healthy, and two, helps to promote good eye care and good conductivity of the nerves that allow light to pass through to produce vision. Of course, maintaining good dental health is very important, and we should be seen by a dentist at a minimum of twice a year. And of course, foot care. We've only got 2 feet, and we've got to take care of them. And so examining our feet, making sure that they're clean, making sure that we're wearing appropriate shoes and footwear, making sure that we have the appropriate support for balance, strength, and flexibility. Those are all important. And you should know your healthcare representatives when it comes to concerns about your insurance coverage. A lot of people don't necessarily know what benefits they have, and so they're missing out on some opportunities, or what their limitations are, which can then create excessive expense to the individual. And for many of us that are aging, we live on a limited budget. And so expensive out of the pocket medical care can then become a financial burden. So it's important that you know who your healthcare representative is and that you are communicating concerns and questions to them. So what are some of those preventive care measures? I mentioned a few already. We want to see your healthcare provider at least twice a year, unless you have chronic disease. If you have chronic disease such as diabetes, hypertension, high cholesterol, heart problems, kidney problems, then you're going to need to see your primary care physician and or a specialist more frequently. Eye exams. We should have an annual eye exam, not just for glasses, but especially those individuals who have health conditions. We want to have an evaluation of the back of the eyes to make sure that everything is going well. We talked a little bit about foot care. It is important that we have the feet clean. We're careful about whom we allow to cut toenails and remove calluses and things of that nature. It is best to go to a health professional, especially if you have a chronic condition. We need to keep up with our digestive health as well. We should have our colonoscopy at age 45 and then one every 10 years after that until about age 75 or until directed to stop by your gastroenterologist. Women, pap smears and mammograms as appropriate up until about age 75. Immunizations. We're going to go into a little more detail about the immunizations in just a second, but those are important preventive care measures that need to be taken. And of course, our routine labs when we go and see our physician. That is one of the indicators that allows our physician to guide our care. And so those lab results become a very important part of healthy aging. We want to have the kidneys evaluated to make sure that they are functioning properly. We want to keep our patients off of dialysis. And again, I mentioned dental care. We need regular care for cavities, gingivitis, gum disease. We want to make sure that our oral care is well taken care of because that can be a preventative to taking in appropriate nutrition, which then affects our health and well-being. And of course, we want to make sure that we are having our routine health screenings for cancer, especially men with the PSA lab test and a prostate exam. So these are all preventive care measures that we need to take to help to ensure healthy aging. So when we look at vaccinations, you'll see here, this is produced by the CDC, and it is the record of what vaccinations should be done at what ages. And if we look at the category between the fourth category, 50 to 64 years of age, you can see what the CDC recommends that we should have. So for the age group of 50 to 64, at least one dose of the COVID-19 vaccine. We should each have the influenza vaccine. If you are 60 years of age to 74 years of age or have respiratory issues, you should have the RSV vaccine. You should have a Tdap or a TD. The Tdap is done with pregnancies, and then it's done every 10 years for adults. That's your tetanus and diphtheria. Your MMR is your measles, mumps, and rubella, and you should have it if you are 65 years of age or younger. Chickenpox. Well, in the United States, if you were born after, I'm trying to think what the year was. Anyway, if you're younger than 43 years of age, you should have the chickenpox vaccine. If you are older than 43 and you hit that age group from about 50 to 64, you definitely should have the shingles vaccine. Those individuals between the ages of 18 to about 50 should have the hepatitis B, the Hep V vaccination. Everyone should have the pneumococcal vaccine, the Hep A. If you're under the age of 59, you should have the hepatitis B vaccination. You should have the meningococcal and the HIV, as well as the Mpox. Now, I'm not quite sure. The Mpox is the new vaccine for smallpox. As far as foot care is concerned, now this slide, of course, says foot care for people with diabetes, but what it should say is foot care for people, because we should all take good care of our feet. Diabetics just happen to be more susceptible to infections, amputations, and death related to those infections. But The general guidelines are that we should keep our feet clean, so they should be washed in warm water every day. Our feet should be dried well. The skin should be kept soft. That means we should moisturize our skin. You should inspect your feet every day for cuts, blisters, swelling, discoloration, and you should talk to your doctor right away if you're finding something wrong. You should ask a member of your healthcare team how to care for your toenails. Diabetics need to be very careful. If you have diabetes, you should not be allowing someone to scrape the bottom of your foot with what looks like a cheese grater. You should be wearing clean, soft socks that fit, that aren't cutting off the circulation to the bottom of the foot. You should keep your feet warm and dry. Basically, we should not go barefoot. And you need to examine your shoes every day for cracks, pebbles, nails, or anything that could hurt your feet. So taking good care of your feet is part of healthy aging. So to conclude the discussion, I know this seemed rather short today, but healthy aging is a continuous process of optimizing the opportunities to maintain and improve our physical and mental health or well-being, our independence, and our quality of life through our life course. As we get older, the risk of chronic diseases such as dementia, heart disease, diabetes, arthritis, and cancers begin to elevate. So maintaining a lifestyle with healthy behaviors and managing those chronic diseases can help people be as healthy and as independent for as long as possible. So again, I thank you for your attention. And now I'll address any questions that I did not answer during the presentation.
Okay, so there was one question that it says, what does 15 to 30 grams of protein look like on a plate? And meaning, what is the proper portion size?
Wonderful that you asked that question. It's about 6 to 8 ounces of protein. But if we're talking about visually eyeballing your protein source, we recommend that your protein source be the size and the diameter or the thickness, the diameter and the thickness of the palm of your hand. Without including your fingers, your protein source should be the size of your palm. And of course, some people have bigger hands than others. Most men have bigger hands than most women. So their need for protein is greater than that of a female. So about 8 ounces or a deck of cards is another way of visualizing what your protein source or serving size should look like. Any other questions, Heather?
If there are any other questions, if you can post them into the chat, you can also take yourself off of mute to ask the questions as well. Yes, you can get assistance in locating a primary care doctor. If you can email me, my email address is heather.williams@healthtexas.org. So that way I can go back and forth with you. Because I'll need to get your address and stuff like that. And I don't want you to put that through through the email unless I send you a secure email. So, but if you can email me and we can start working on that PCP.
Did you say your email address again? Sorry.
Here, let me type it in the chat.
Oh, perfect.
There you go. So another question is, how many eggs can you eat per day?
Well, typically the average American consumes about 2 eggs for breakfast every day. That is not necessarily the healthiest thing to do, especially if you have high blood pressure or high cholesterol. What is recommended is for every 2 eggs, you have 1 yolk. Egg whites are healthier for you. They don't contain the cholesterol. Basically, the human body makes all the cholesterol that we need. And the rest of the cholesterol in our body comes from the foods that we eat, mostly animal. And the yolk of the egg is what grows into the chicken. And so the concentration of cholesterol in an egg is in the yolk. So if you're having egg whites, 2 a day is not a problem. If you're having scrambled eggs, take the yolk out of one and then scramble the 2 eggs. I used to do something really mean, but it helped my ex-husband, and that was he loved scrambled eggs, but he had very high cholesterol. So he didn't know it for a very long time, but he would get just egg whites with food coloring to make them look yellow. And then I would add a little bit of something to it to add flavor, like maybe even a little garlic powder, a little onion powder. And he loved his scrambled eggs, and his cholesterol went down. So 1 egg, 2 eggs, 1 yolk.
Are there any other questions? Okay. So if there aren't any other questions, this will conclude the presentation. And I do greatly appreciate you guys joining us today. And I
Thank
hope you
you
guys
so
all
much.
have a wonderful day and the rest of the week.
Thank you again for your participation.